Lawmakers have been discussing ideas to aid the state's struggling healthcare workforce, and physical therapists across the state say they may have a solution to ease the burden. Kate Lisa has the latest on this. She joins me now from the state capitol. Hey, Kate.
Hey there, Susan, and exactly. So members of the state chapter of the American Physical Therapists Association met with lawmakers last week about several pieces of legislation that pertain to physical therapy care here in the state that they're looking to get passed before session ends in June. And a bill at the top of their list would give physical therapists full direct access to patients, but top medical experts are pushing back. Physical therapists with less than 3 years experience can only treat patients for 10 visits or 30 days without a referral. Now, members of the American Physical Therapy Association are pushing to end that rule and allow all licensed physical therapists in the state to have full direct access to treat patients without restrictions. APTA New York President Michael Tisby says it will allow New Yorkers access to PT care without waiting for a referral, which will reduce surgeries, the use of addictive painkillers, and overall health costs.
Given the fact that there's less and less primary care physicians that are coming out of school, that are working in New York State, we're looking to really help be the triage, be an entry-level profession, and really to help prefer to those specialists the appropriate patients they should be seeing.
Tisby argues PT degree programs are at the doctoral level, and new therapists are more than equipped to treat injuries and reduce patient loads in doctors' offices and emergency rooms. Physical therapists have pushed to scale back the state education law requirement for over a decade and say it's time they work to their license potential.
There's no good reasons why there should be limitations on direct access. We've had direct access in the state since 2006.
Marcia Spoto is a physical therapist and chair of the Public Policy Committee with APTA, who says insurance companies curtail visits, which in turn prolongs the patient's care.
It's in no one's interest to extend care beyond what's needed. Most people we get people moving. The sooner they get in to see us, the better.
But several health organizations are lobbying against the bill, including the State Medical Society and the State Society of Orthopedic Surgeons. They argue the 10 visits or 30 days for evaluation mandated under state law does not inhibit patient access to physical therapy care. In a memo against the legislation, the society says in part, quote, "If enacted, this legislation will fragment the coordinated team approach, increase the time for treatment and definitive diagnosis, which may result in increased costs and negatively impact patient safety. Physical therapy is very important, and it should be done in collaboration with the physician," end quote. Several lawmakers also share those concerns, which has kept the bill stalled in both higher education committees. But others, like Assemblyman John McDonald, say they'd support the measure if it came to the floor for a vote. McDonald has been a pharmacist for decades and says physical therapy allowed him to avoid surgery for a torn meniscus while campaigning and without addictive painkillers.
It worked like a charm. It was 8 weeks. And quite frankly, it reminded me of how the body works, how the body moves.
Proponents of this change also argue that it will cut back on the use of addictive painkillers. When I spoke with Assemblymember John McDonald about that today, he said with his experiences as a pharmacist, he thinks that it may reduce people who use opioids long term, but he doesn't expect it to have an impact on the number of overdose deaths here in the state, and that support for substance use disorders is still critical. Susan?
So, Kate, yeah, that's a very interesting perspective that you got from Assemblyman McDonald. How likely is it that lawmakers will get to this issue this session, which ends in June?
Right, we've got about 5 weeks to go. Spoke with some lawmakers today who are on the higher education committees where this bill specifically is stalled. And there's a lot of kinds of scope of practice bills like this that would affect healthcare workers here in the state that are very difficult to move. They often don't get out of the higher education committee. Lawmakers are saying they don't think it will again this session, that they think that it will maybe weaken health standards. And that's something that they're concerned about doing here in the state.
Very good. Thank you so much, Kate Lisa.